Welcome to another episode of the Teen Titans podcast. Today we're going to discuss how government policies and systems affect today's healthcare and then how this all plays a part in the racial disparities in the healthcare system. So first I'm going to talk about structural racism because that mainly affects stuff like health insurance and how government policies are passed. So in Monica Peake's paper, Racism in Health, a call to action for health services research, she defines structural racism as policies and procedures that either directly or indirectly are harmful to minority groups. This is because decades worth of the discrimination in America. So structural racism doesn't really just affect the healthcare system, it's everywhere, but it still is a major contributor. And a good example of this that Peake provides in her paper is that during the 60s there was a lot of residential segregation, and now today a lot of minority communities are really vulnerable to natural disasters, and she referenced Hurricane Katrina and then the most recent pandemic. So, and then some more examples are from a different article called Race and Rationing that was written by Renee Bowser, and she mentions the Hill-Burton Act of 1946 and the hospital flight movement during the 70s, which the Hill-Burton Act is an act that provided federal funding towards segregation of hospitals, and then the hospital flight movement was a time during the 70s when a lot of hospitals either completely relocated or moved specific specialties from minority dense communities to more white suburban neighborhoods. And this just affects minorities today because now a lot of minority communities don't have equal access to good quality hospitals because they all moved.
So what are some modern examples of these healthcare disparities?
I think a more modern example is how health insurance, how they distribute health insurance and decide who gets it, qualifies for it, and then the Affordable Care Act, also known as Obamacare, which is just another type of insurance. So a lot of the qualifiers for private insurance companies are the location someone lives in and their income. And as stated in previous episodes, a lot of minorities' income may be a bit lower because of where they live and their location. If you're not living in what's deemed a quality neighborhood, they might say oh, you can't have this insurance. But because of redlining and everything, it was mentioned before. Yeah, so all of this just negatively affects their chances of receiving insurance, and according to the Kaiser Family Foundations, they provided some statistics of the uninsured rate among groups, and it shows that 21% of Hispanic people are uninsured, and then 10% of Black people are uninsured compared to only 7% of white people.
Oh wow. Yeah, I did notice that you only mentioned private insurance companies though. I mean, aren't there government funded health insurances like Medicaid, Medicare, and Obamacare? Do those help?
Yes, those do help, but their qualifications are still really specific. Some you have to be over a certain age or only disabled. So not everyone qualifies for Medicaid and Medicare. And then even if you do qualify, they're not the best insurances you can get. For example, Medicare doesn't cover dental or vision, which can both be very expensive without insurance. So it's not really the best options they can get. And then in the article I read by Renee Bowser, she mentioned how Obamacare is also not the best solution because it allows insurers to charge more based on age, geographic, and like their location. And this is like the same problems we had with private insurances, like either raising the price of insurance or not qualifying people because of like factors that they can't really control.
Wow, this is all so crazy. Is there any way to do something?
Well, because a lot of this is from structural racism and just government policies, we can't do a lot because it would require the government to pass like new laws to change a lot of the healthcare system and making it more accessible. But we can raise awareness by this podcast, for example, raising awareness and encouraging people to like urge their legislators or elect people who are going to change this and pass good laws. So this is why we're making the podcast. So thank y'all for watching this episode of our podcast. We're gonna end it here. I'll watch the next episode.